Hello everyone. So today we are going to discuss about the blood supply to the brain. So blood supply to the brain, please remember, it is given by a circle that is shown in the diagram. This is known as circle of Willis. So please remember this circle of Willis. This is the circle of Willis, and this circle of Willis, it is given blood supply to the whole brain. This circle of Willis, please remember, it is present in the subarachnoid space. Okay, it is present in the subarachnoid space. Okay, at the base of the brain. At the base of the brain. Okay, and this circle of Willis, which is present in the subarachnoid space, that is the subarachnoid space, it is formed by the anastomosis of internal carotid artery and vertebral artery. Okay, so internal carotid artery, this one is anastomosing here with these your vertebral arteries, and now they are making here the circle of Willis, which is giving blood supply to your whole brain. Okay, so how we are going to understand this diagram? See here everyone. First of all, at the base of brain, anteriorly we have the internal carotid artery, and posteriorly we have vertebral artery. Okay, so vertebral artery, please remember, this is your vertebral artery. See here, vertebral artery is present posteriorly. Okay, and is joining together here, forming this artery. This artery is known as the basilar artery, and in the end it is going to give this branches. This is known as posterior cerebral artery. Okay, so the vertebral artery, which is present posteriorly, it is contributing into the circle of Willis by this posterior cerebral artery. Okay, so vertebral artery, please remember, it is going to and joins to form basilar artery, and it is going to form this basilar artery will give the branch of posterior cerebral artery. Okay, posterior cerebral artery. So in this diagram, see here, this is your right vertebral artery, this is your left vertebral artery. So both are joining together, forming this basilar artery, and this basilar artery is going to give here these two branches, which I am drawing in the blue color. This is your posterior cerebral artery, which is contributing in the circle of Willis. In this diagram, this is the vertebral artery, this is the vertebral artery joining together, forming the basilar artery, and then it is going to form here this artery. This artery is known as posterior cerebral artery. Okay, so this is one point. Second, your anteriorly your present is the internal carotid artery. So please remember, internal carotid artery, it is contributing into the circle of Willis by two arteries, that is the anterior cerebral artery. Okay, and it is also giving here one more branch, that is the middle cerebral artery. So three arteries are giving blood supply to the brain: anterior cerebral artery, middle cerebral artery, and posterior cerebral artery. But very important point, please remember that this middle cerebral artery, it is not contributing in circle of Willis. Okay, so in circle of Willis, two cerebral arteries are only contributing. One is the posterior cerebral artery, which is a branch which is coming out from the vertebral artery, and second is the anterior cerebral artery which is coming out from the internal carotid artery. So see here in this picture, this is your internal carotid artery, and this is the branch which is going anteriorly. So this is your anterior cerebral artery. Okay, so this anterior cerebral artery, this is the anterior cerebral artery. Okay, so this anterior cerebral artery is coming out directly from the uh, internal carotid artery. Then it is giving here this branch. This is your middle cerebral artery. But this middle cerebral artery, it is not contributing in circle of Willis. So please remember, it is not contributing in circle of Willis. Okay. So now we must have to discuss it in detail how this circle of Willis is going to form. So as you can see in this diagram, this circle of Willis is present at the base of the brain. Now what we must have to know, we will start from the vertebral arteries. So first of all, see here that two vertebral arteries, they are going to enter into the cranial cavity through foramen magnum. So they enter into the cranial cavity through foramen magnum, and they are going to join together at pontomedullary junction. And at the pontomedullary junction, they are going to join together and forming one single artery that is known as the basilar artery. Okay, the basilar artery. And now this basilar artery will give here the branches. It will give the branches like pontine arteries, which is giving blood supply to the pons. It will give a branch also. It will also give a branch also known as anterior-inferior cerebellar artery. Not cerebral artery, cerebellar artery. Okay. And it will also give a branch of labyrinth artery. Please remember, labyrinth artery in most of the people, for example, in 80% of the people, it is coming out from it is a branch of anterior inferior cerebellar artery, and in 20% of the people, it is coming out directly from the basilar artery. Okay, so this is the point in relation to labyrinth artery. Please remember, so labyrinth artery which is supplying your inner ear, it is giving blood supply to your inner ear. In 80% of the population, the labyrinth artery, it is coming out from the anterior inferior cerebellar artery, but in 20% of the people, it is coming out directly from the basilar artery. Okay, it is also giving here the branch that is known as the superior cerebellar artery. Okay, so if I draw here one diagram for all of you, so see here everyone, for example, this is your see here, this is the medulla oblongata, this is the pons, and this is the midbrain. Okay, so see here, so the two vertebral arteries, they are entering into the cranial cavity through the foramen junction and at the pontomedullary junction. So this is the pontomedullary junction. They are joining together forming one single artery. So this one single artery, it is known as the basilar artery. Okay, and then it is going upward and giving here this branch like this. So this is your posterior cerebral artery, which is giving blood supply to the brain. And here it is also giving here the branch. This branch is known as superior cerebellar artery. superior cerebellar artery. Okay, here it is also giving here the small branches which is giving blood supply to the pons. This is known as the pontine arteries. Pontine arteries. Okay, and this basilar artery, it is also giving here this branch, this side also. So this branch is known as what? This is known as anterior inferior cerebellar artery, ICA. And from this ICA, there is a one branch I will draw here on this side. This branch is known as what? This is your labyrinth artery. Okay, so this is your labyrinth artery. So please remember, labyrinth artery which is giving blood supply to your inner ear in 80% of the population, it is coming out directly from the ICA. In 20% of people, it is coming out uh, directly from the basilar artery. Okay, now here two more arteries are very important which you must have to know. What are these two important arteries? See here everyone. Uh, from the this is your vertebral artery. This is your vertebral artery. Okay, so this vertebral artery is giving here a branch like this. Okay, like this. So this is your anterior spinal artery. Okay, so anterior spinal artery, it is a branch of vertebral artery. Okay, and it is supplying what? It is supplying 2/3 of the spinal cord. It is giving blood supply to the 2/3 of the spinal cord. Okay, vertebral artery is also joining here. It is also joining here posteriorly and making one more branch. Okay, so this is your posterior spinal artery. Posterior spinal artery. Okay, so posterior spinal artery, it is also a branch of the vertebral artery. It is also a branch of the vertebral artery. And please remember, it is giving blood supply to the posterior 1/3 of the spinal cord. Now, why these arteries are important? Because clinically, see here. Okay, and one more artery, that is the pica. So this is the pica. I will draw it in green color. So pica, it is also this green color. This is your pica. Posterior inferior cerebral artery, pica. So pica, it is also a branch of your vertebral artery. Okay, it is a branch of the vertebral artery. So all these arteries which I draw here in the diagram, that is the basilar artery, vertebral artery, anterior spinal artery, posterior spinal artery, all these arteries, please remember, all these arteries are giving blood supply, giving blood supply to your medulla oblongata, except one artery, and that exception is your this artery. So superior cerebral artery is not giving blood supply to your medulla oblongata, and all the other arteries are giving blood supply to the medulla oblongata. Okay, now what are the clinical correlations in relation to these arteries? So see here everyone. uh, Number one, posterior inferior cerebral artery occlusion can lead to lateral medullary syndrome. Lateral medullary syndrome, which is also known as Wallenberg syndrome. Wallenberg syndrome. Okay, so this is known as Wallenberg syndrome. But please remember, Wallenberg syndrome, most commonly it is due to the vertebral artery occlusion. So most commonly it is due to the vertebral artery occlusion. Okay, and please remember another MCQ, that medial medullary syndrome. medial medullary syndrome. It is due to the occlusion of anterior spinal artery. Anterior spinal artery. So see here, anterior spinal artery occlusion will lead to medial medullary syndrome. Vertebral artery occlusion most commonly leads to lateral medullary syndrome, or posterior inferior cerebral artery can lead to your what? Lateral medullary syndrome, or also known as Wallenberg syndrome. Okay, so this is our discussion. This is, now see this diagram everyone. This is your posterior communicating artery. This is the posterior cerebral artery, this one, which is coming out from your basilar artery. It is giving here the pontine artery, and can you see in this diagram that in this diagram they directly draw the labyrinth artery directly coming out from the basilar artery. But most commonly it is coming out in 80% of people. It is a branch of your anterior inferior cerebral artery. Vertebral artery, see here in this diagram, it is giving here posterior inferior cerebral artery also. It is giving here the branch of anterior spinal artery also. Okay, so this is how you are going to explain this uh, picture. Okay, so now we must have to write down the anterior section, that is the internal carotid artery. So see here, internal carotid artery. It is going to give here the branches: anterior cerebral artery, middle cerebral artery, posterior communicating artery, ophthalmic artery, and anterior choroidal artery. There are some other branches. When I will draw it, then I will explain to you. So these are the main branches which you must have to remember. Now see here, middle cerebral artery, it is not contributing in circle of Willis. This is your first, this is your MCQ. Okay, now see here how you are going to draw this diagram. So this is the internal carotid artery. From internal carotid artery, this branch is going here like this one. So this is your anterior cerebral artery. So this is your anterior cerebral artery. Okay, so this anterior cerebral artery, it is going to join together here by this artery. This is known as anterior communicating artery. Anterior communicating artery. Okay, from this internal carotid artery, this artery is going here. So this is your middle cerebral artery. Okay, now see the diagram. This is also, now here you have the vertebral arteries. Vertebral arteries are joining together, forming here this artery. So this is your vertebral artery. It is joining together, forming here which artery? The basilar artery. And this basilar artery, it is giving here this branch. So it is making here your which artery? This is your posterior cerebral artery. Posterior cerebral artery. Now it is communicating here with the circle of Willis. So this artery is known as posterior communicating artery. So now this circle is formed. So this is known as circle of Willis. So this is how the circle of Willis is formed. Okay. So posterior communicating artery, posterior cerebral artery. Here this will be your middle cerebral artery, anterior cerebral artery, anterior communicating artery. Now very important point clinically which you must have to remember. This anterior communicating artery, most commonly you will find here the Barry's aneurysm. which can sometimes rupture and lead to the leakage of blood into the subarachnoid space, and uh, and it will lead to subarachnoid hemorrhage in the patient. Okay, so most commonly it is the anterior communicating artery. Sometimes it can be seen in the posterior communicating artery also. So when it is Barry's aneurysm is in relation to the posterior communicating artery, it can lead to the damage of your third cranial nerve, or maybe compression of the third cranial nerve, that is known as the oculomotor nerve. Okay, so oculomotor nerve can be damaged here. Now some important points here also which you must have to remember. From this internal carotid artery, there is one branch is coming out. This branch is known as recurrent branch of Habuner. Okay, from internal carotid artery, this branch is your ophthalmic artery, this one, which is giving blood supply to your eyes, ophthalmic artery. From this branch here, there is one artery coming out, that is your anterior choroidal artery. And one more branch is coming out, which is giving blood supply directly to the genu of internal capsule. So see here, if I draw here the internal capsule like this. So this internal capsule like this. So this is the internal capsule now. So this internal capsule, please remember, it has two surfaces. This is the dorsal surface, okay, and this one, this is the ventral surface. Okay, so ventral surface. So this is the anterior limb of the internal capsule. This is the posterior limb of internal capsule, and this part, this is known as the genu of the internal capsule. Okay, now see here important point. This upper dorsal surface, which I highlight in this one, yellow color. So this yellow color part, which is the dorsal surface of the internal capsule, this whole, you can say, dorsal surface of the internal capsule, it is given blood supply by the middle cerebral artery. Okay, and by which branches of the middle cerebral artery? That is known as the lenticulostriatal branches. Okay, please remember, lenticulostriatal branches or middle cerebral artery, it is not only giving blood supply to the dorsal surface of the internal capsule, it is also giving blood supply to your basal ganglia also. Okay, so it is also giving blood supply to the basal ganglia also. Now coming into this ventral surface. So I highlight the ventral surface in pink color. So this is the ventral surface of the internal capsule. So this ventral surface of the internal capsule, this one, it is given blood supply like this. For example, the anterior limb of the internal capsule of the you can say ventral side, it is given blood supply by the recurrent branch of Habuner. First MCQ. Second MCQ. Posterior limb of the internal capsule. That is this is the blood supply of now lower ventral part. Okay, ventral part. Dorsal part, this one, this dorsal part, it is given blood supply by this artery, by these branches. Okay, so posterior limb of internal capsule, it is given blood supply by the anterior choroidal artery. and the genu of the internal capsule, it is given blood supply by the direct branch of internal carotid artery. Okay, so see here, these are the three branches which I draw here. That is the recurrent branch of Habuner, direct genu of the internal capsule, and anterior choroidal artery. All are coming out from your internal carotid artery. So this is how your blood supply of the brain. I hope it is clear to all of you.